Hi, everybody. My name is Emily. I identify as she, her, hers. I live in North Carolina and I'm 28 years old. I specifically identify in the community of farming, agricultural practice, horses, holistic wellness, cooking, baking, among the like. I'm really interested in starting new hobbies this year, so I'm going to learn how to sew and quilt. So I'm just really excited. I love trying new things, but predominantly my community is rural area. So that's something that I've grown up with my entire life, and it's something that I'm really interested in promoting and advocating for our farmers and agricultural businesses. Um, excuse me. I'm interested in social work specifically because I want to get my LCSW in one-on-one trauma counseling and then specializing in EMDR, specifically therapy for clients that are intellectually disabled or have Down syndrome, because I find that they're quite misunderstood in the counseling world and they're not really taken seriously in the medical world. So I feel like there needs to be a happy medium between the two, and I really feel like EMDR or counseling can be that. So I really want to look into that because I don't think there's enough research on it. I have about 10 years plus of experience in healthcare. I've been a certified nursing assistant since 2014, and I've worked alongside dementia patients. I've worked with psychiatric patients from ages 5 to 60 plus. And then I've also worked with patients that are in acute centers and chronic centers. And I've also worked with in a psychiatric hospital where they're chronic offenders and they are doing long-term sentences due to pleas of insanity in the courtroom. So I feel like I'm trying to get more experience in my field placement. So currently I'm working with students with intellectual disabilities and helping them make SMART goals in their semesters at college. So being a peer support for them. So that's something that I kind of try new things as much as I can and kind of throw myself into different demographics and involve myself to learn about them, just so that I can be a more well-rounded counselor in the future. But yes, I've loved my experience since 2014 being in healthcare. I feel like healthcare is something that everybody can do. There's a job for everybody out there, so I'm just really happy to promote something like this as far as social work and healthcare. And then macro, I'm really excited to learn about advocacy and community. A lot of the things that we're learning in my field practice is teaching the students how to advocate for themselves in any situation, and giving them that confidence and independence to do so without us present. So I'm really interested in that, and then also getting them involved in their community. So I'm in Greensboro area with my practicum, and with that being said, I really want to learn about how to advocate for my students without doing it for them. That's something that I really struggle with because I kind of want to jump in and help, but really that's not helping all the time. So I really want to learn how to advocate for my students and do it in a way that gives them that independence, so that they can do it themselves and advocate for themselves. So I'm really excited to learn about that in this class. And macro studies with the community based, I'm really interested in, as well as getting involved in politics when it comes to social work and social work policies. It seems to me that when we learned in our classes last semester, that's something that's really influential, and that's something I want to also really learn about as well. So I'm almost at 5 minutes. This is really hard. This is like the 5th time I've tried this, so I hope you enjoy, and I'm excited for this class.